What's up, dog, everybody? This is Torrential Downfall, and today's topic is therapy. You may have heard of therapy before, but in short, it's working with trained professionals to help someone manage their mental and/or physical health. For the purpose of this video, we'll be focusing on therapy for mental health. However, physical therapy is super important and vital for those recovering from injuries and traumas. But from the patient side, it may be seen as simpler to understand, i.e., you might have a broken bone or torn muscle. You then might need, from treatment side, rest and to do specific exercises alongside any surgery you may need. Don't get me wrong, the treatment from the professional side may be complicated, and the road to recovery for the patient side may also be long. But hopefully I'm getting the point across that, from the patient side, it's simpler to understand or digest what needs to be done. Anyways, back to the focus, which will be therapy for mental health. You may have heard of counseling, you may have heard of therapy, but never really known what's the difference. In short, counseling tends to be tackling more short-term problems, whereas therapy is for more long-term issues. For example, you may choose counselling if you're struggling with the loss of a pet or if you've just lost your job. It tends to be looking at an external stimulus that you may be struggling to cope with in the moment. However, just because it's short-term versus long-term doesn't make the experience any more or less emotionally draining. Both short-term and long-term issues can lead to equally bad outcomes if not addressed either personally or professionally. So again, this isn't a video that's saying someone going through therapy is automatically doing worse than someone going through counselling. But again, for the focus of this, it will be mental health for long-term issues in terms of therapy. The kind of reasons why someone may require therapy could be abuse, personality disorders, eating disorders, or suicidal thoughts as examples. But who am I to talk on this subject? In essence, nobody. But for some of you more avid viewers of this channel, you'll know that one of my friends agreed to talk to me again if it was on the topic of therapy. So I was glad to speak with her again, even if she did brutally and, horribly reject me and call me an ugly, filthy animal. But to avoid any further insults, I wanted to get straight to the point. I asked her, what are your experiences when it comes to therapy? She said, you're lucky that I'm even agreeing to talk with you again, you dirty dog, but she would like to spread some light on the topic and to help break down the stigma and embarrassment surrounding it. She said she'd been through both counselling and therapy, but before she started the process, she thought it was going to be quite simple, like how you go to a doctor and they if you've got an infection, they'll give you a prescription. She didn't realise how detailed therapy would be. She mentioned that she'd had mostly positive experiences, but there was one instance that stood out, which was negative, and it gave her trust issues for a very long time. In short, in her first session, and she mentioned that she was new to therapy at the time, she explicitly told her therapist not to tell anybody else about what they discussed. As a viewer, you might already know where this is going, but literally 5 minutes later, the therapist is telling everything about that they'd spoken about to her parents. In that moment, she'd never been more hurt or angry at sharing with someone, than ever before. They were, in her opinion, the worst people to tell at the time. On top of that, there was no escape. She had to go home with them knowing. I was, a bit curious considering I'd also thought that therapy was confidential as well, right? I'd asked her, what had she shared in her first meeting that this therapist felt compelled to betray, any trust that was made in the first meeting. She said that she wanted to take what she learned from the experience first before, getting into that. The most obvious point that she wanted to make was that therapy being confidential, she learned that day, is not always the case. Look, for the most part, it is. You could talk about 99% of the things that you could possibly think of, and that would be kept confidential, right? So it's a very valid statement for it to be portrayed and kind of advertised as, right? But, she said, I don't know why she just decided to do it this way, but looking me up and down multiple times, said, let's say theoretically you, Torrential Downfall, were to get brutally rejected many times when it came to women. You could share that in therapy and that would stay confidential. I had to chime in as well, just at this point, and say, just to clarify, this is all theory, right? Because, what are the likelihoods of that happening, right? However, she wanted to bring it back onto the topic and say, look, 99% of the things that you talk about in therapy will be confidential. Or 99% of the things you could possibly talk about in therapy are confidential. So 99% of the conversations that are happening in therapy will always be kept between you and the therapist. However, there is a 1% of topics of conversation where the procedure is, from the therapist's point of view, to break confidentiality. She wanted to repeat, the procedure is to break confidentiality. It's not, a matter of personal opinion. So what does that 1% involve? She said this would be when you're an immediate risk to yourself or others, or if there's evidence of neglect, abuse or exploitation, on the person, or when there's a legal duty to report, what's being discussed. That did get me curious, and I had to ask the question, what did you share in therapy that your therapist felt compelled to share it to your parents? Sorry for asking again here. She paused and looked a bit unsure. And to be fair, I said to her, right, she didn't have to share anything she wasn't comfortable with. She said even though it was over a decade ago, it still felt raw, like she was in the room with that same therapist as if it had been earlier today. She guessed it was because of, how the pain felt from the betrayal and how that never really left her. But she wasn't going to hide the facts just because of how somebody else made her feel. She said that she was suicidal, which, is what therapists relate to her parents. And she wanted to make it clear, that procedure and protocol makes total sense to explain, that action of the therapist. However, the therapist also shared extra information about friends that was in explicit detail. This information could have easily been kept confidential. However, that's what the therapist chose to reveal on top of everything else. So yeah, that really shocked her to her core to get betrayed like that. And I said, look, that must really suck to trust someone and have that taken away. Not that it just happened to you so quickly, but also because of how important the topic of conversation was to you. So, like after that, what was your experience of therapy like? Did you give up on it after that point? That mustn't have been great as your first experience. She said, yeah, she did give up on it for a while. For one reason or another, she found herself in front of other therapists. in both individual and group sessions. Yeah, she found it hard to open up, mainly because of the betrayal. Part of her wanted things to work, and she wanted to make a change. And at times she would share a little bit, some day-to-day thoughts. For example, today was a good day, yesterday was a bad day. But for the important stuff, she kept it hidden, afraid of what the consequences would be if she let it out. She was stuck in a place she couldn't leave because of her mental health issues, and she hated being stuck there. So she did what she could to get her freedom back. She lied in whatever face, in whatever manner, in front of whatever authority to get out. Looking back now, this is where she learned her most important lesson about therapy without even realizing it. Therapy initially didn't work. Ultimately, it was because she didn't want it to. She wasn't willing to let go of her thought processes, her feelings. If anything, she was fighting against anything good, including therapy. But when she became desperate, running out of time and unsure what to do, she decided to give therapy a go again. Oftentimes, a stimulus for counselling became an extra external stimulus that became too much for her to handle in her current life at the time, and that was a driving force for wanting to try and make things better. This could be losing friends, struggling with education, or struggling with work. The reasons almost didn't matter, I guess, for the purpose of this next lesson, but it was just important for her to be in front of different therapists, in front of different people, essentially. The second lesson she learned about therapy, looking back, was the importance of chemistry with the therapist. She inherently understood this after her first experience in therapy, where any chance of therapy was broken, or should I say any chance of chemistry was broken. She didn't give other therapists a chance to build a rapport in those early moments because of that first experience. However, when she started to open up, when she felt desperate and out of control, eventually she did build that rapport with a few therapists when it came to some immediate worries. So if you don't feel like therapy is working, or you don't feel comfortable enough to share, without meaning to sound corny, she said, it may not really be you. It might be the therapist. So you might need to speed date to begin with, to try and find a good match. As a side note, she'd mentioned in a previous video, there are different types of therapy. Some may want to try CBT, some may want to try DBT. Others will be very, very insistent on your problems and habits stemming from childhood, like super, super insistent. And you may have to eventually admit that they may have a point, but not just with chemistry, but with different techniques for therapy. It's important to be exposed to different styles. You shouldn't just give up on therapy if one style doesn't work. She wanted to make the point that you don't need to keep exploring and trying new therapies as that being the only way to be successful. The sooner you can find one that works, the better. But also some of why you might be uncomfortable sharing or struggling to make that connection could also be slightly on yourself rather than the therapist. But she just wanted to make the clear point that you shouldn't give up on therapy because of one or two disappointing experiences. And I just wanted to thank her at the time, just because it was really interesting to hear some of the lessons that she's taken from therapy. I hadn't realised there was so much to consider even before you'd started almost. And then I was just curious, moving on from this, like, what's therapy like? As in, how does it start? What's that opening conversation like in therapy? She wanted to mention that there's one thing that therapists love. I was like, what is that? She said, questionnaires. Sometimes before meaningful conversations, they get you to fill forms depending on, why you're there, and sometimes it can be a lot of forms. She said, like, remember how we'd spoken about the difference between counselling and therapy? How one tends to be for shorter term problems and one for longer term problems. Questionnaires are a great way to find out the difference from the treatment perspective. Questionnaires are also a great way to see if you, sounds stupid, but if you need more questionnaires. For example, if you show signs of a personality disorder or something like Asperger's, then you could be given a more detailed test to give a more conclusive diagnosis. As someone going to therapy, a diagnosis may be important to you, it may not. But what it does do is give you, you the best chance of getting the most appropriate treatment. Also, it's this kind of information that can be very useful for you if you do need to see a new therapist, so that you may not have to keep filling in the same forms. I asked her, aside from all these forms and questionnaires, what else is there? She said, really and truly speaking, anything you want to speak about. It tends to begin with how things are immediately, if you're not sure what to speak about. However, there will be parts of conversation that your therapist will want to flesh out or speak about, in further detail, even if you may not want to initially. If your therapist asks you a question more than once, they think it's worth you answering, and most of the time they'll be right. Therapists tend not to speak so much, but it's definitely not like you're speaking to a brick wall. They tend to let you fill the space, which may be something, or a topic about, something you've been holding on to and you hadn't even realised it was on your mind. Therapy can be quite emotional, quite heavy, quite draining. However, it's a safe, controlled space that can help you take a weight off your shoulders that you may have been carrying for quite some time. And ultimately, she said, therapy gives you a different perspective than what you already have, which helps you if you have a topic that's, circling in your mind. She knows she mentioned earlier about the 1%, which may not be fully confidential, but for the most part, therapy is confidential. It's a safe space to have a conversation with somebody that you may be afraid to speak about, or something, you may be afraid to speak about with the people you know. The pseudo-anonymity can really help you to open up. The other point she wanted to make is, there is a time limit on therapy. When you speak with a friend, a parent, once you've spoken about it, you can't take that back. You may speak on a Monday morning before school, and then you have to see your parents after school, during dinner. You can't get away from the conversation. However, having a dedicated session once a week almost allows you to breathe and take a break from that topic, which can be super helpful if the discussion's quite deep. She knows she mentioned earlier about kind of how the most important lesson for her is, if you don't want therapy to work, it won't work. She kind of just wanted to expand on this as well. And yeah, I said, go ahead. I'd love to hear more. What she meant was, like, if you have atypical thinking, your thought processes may not only be questioned, but also challenged by your therapist. For example, she said, looking me up and down again, which I didn't think was necessary, but anyway, she said, you might go to therapy and say to them, you have no friends. They might say, how often do you go out or try to socialise? You could say, in the last month, not once. Your therapist then might say, no wonder you don't have friends. Not in a mean way, not trying to insult you, but highlighting the error in your current processes. They may ask you, what are your hobbies? I stood silent there, just waiting for her to continue. She said, "Why are you being silent, you hippo? How am I supposed to know your hobbies?" I said, "Oh, I'm sorry. I hadn't realised you wanted me to answer in real time, but I like football and gaming." She said, "Your therapist may suggest you join a six-a-side team looking for members, or start to add people that you're playing with online to have a more consistent group to play with." Um, the key point she was making is you need to work on therapy to make therapy work. If in a month's time I've not joined that football team or started to add players in the lobbies online, then should I be surprised that I still have no friends a month later, even though I've been doing the therapy? Just because you're seeing someone for your problems, doesn't mean that's the end of it. You also have to work alongside that to kind of implement the advice you're being given. And I was a bit surprised again. I hadn't thought that therapy would be such work, but it makes sense. And she made the point, like similar to physical therapy, you're taking the therapy sessions so that in the future you won't have to rely so heavily on them. What other example could you make? I asked her. That would show challenging these thought processes, without bringing my weight into it, please. She said, "Okay, hippo, I'll keep your way out of it." But she said, for example, you might go to your therapist and say, "You're useless. You're just a good for nothing, idiotic, wasteful bum." I was like, slow down, cowboy. This isn't an audition. And she wanted to apologise actually for getting too into character. However, she said, if you're constantly feeling like everything you do is wrong and you're worthless, your therapist may challenge that. They could ask you before your next session to take notes of the things you've done successfully, no matter how simple. This could be something at work, at home, in the gym, and maybe starting to use these small victories to break down some of the negative barriers you've put up. However, my friend said if you don't put the work in between the sessions, then the therapies will just not be successful in the long term. In the short term, over 1 week, you may be so invested in the thought process that you can't write down anything you did well. But if your therapist can see that you've invested the time and putting the effort into her suggestions, then they can try another method to help challenge that process. I.e., they could get you to ask your manager or your friend to list where you've helped them in the last week. You may discover that knowing what to do is only the start of the battle. Implementing it in your day-to-day life may be the real challenge for some. Ultimately, even though it may be very difficult, you have to work with your therapist to help yourself ultimately. You both may disagree on a lot of things, but your therapist only wants what's best for you, even if you're not quite there to want it yourself. I said to her, wow, that's a really deep thought, and I wanted to let you know that, I'll always want what's best for you. My friend was surprisingly touched by that and thanked me, saying, she appreciated the sentiment and said that it was a lovely thought. Me, thinking that we'd connected as more than friends, leaned in for a kiss. If you're an avid watcher of this channel, you'll know where this is going. She pushed me away, very hard, may I add, and said, "Ooh, you stinky hippo, don't you dare try and touch me. If you have another YouTube idea, then maybe we'll talk again." I'll be honest, after this latest rejection, I may need some serious therapy to get over all this failure. But getting back to the point, I wanted to ask her one last question. You've mentioned that 99% of what you can say in therapy is confidential. What do you do if you want to speak about that 1%? She had to take a pause and think about that. Then she said, look, you might need to ease into it. Maybe you're so desperate that it's the first thing on your mind, so you may just go straight into it, right? But for others, if it's been on your while for a long time, you may need to ease in. Her biggest issue when she lost trust with the therapist who betrayed her was that they hadn't developed a rapport for her to fully understand, what she was going through at the time. When she has developed a rapport with a therapist, she's felt more comfortable talking about the 1%. They may have your therapist may have to have anonymized conversations with the relevant authorities or a supervisor she may have. But if you can articulate your fears and concerns on certain topics of conversation, then your therapist is always going to make the space to make you feel as comfortable as possible, even if the conversation's not. And I just wanted to thank you, or should I say, I wanted to thank her for answering that final question, despite the incident, shall we say, we had a couple seconds before that. And I just thought it best to kind of summarise the points my friend shared on therapy as a conclusion. Number one, therapy will not work unless you work on it. It's not just an hour to work on your problems. It's an hour to focus on your problems, and the rest of time in between sessions is to work on your problems based off professional guidelines. Number two, 99% of therapy is confidential, but 1% is not, being an immediate risk to yourself or others if there's evidence of neglect, abuse, or exploitation, or when there's a legal duty to report. Having said that, and now you being aware of that, that doesn't mean you shouldn't talk about it. If anything, that's exactly why you should. Point number three, there are different types of therapy, and all therapists are different people. So if one therapist doesn't work out, do not give up on therapy. There will be a right one for you out there. As a side note, and what my friend wanted to add actually, is ultimately therapists are human beings too. They feel and have lives as well. Yes, it's their job, but it's a lot more emotionally and mentally draining than some other professions. And even though it may not make a difference to the treatment, treating the therapist as a human being will inevitably help to build and maintain any rapport that you have with them. Thank you for watching, everybody. And remember, as long as it hurts no one, do something nice for yourself today.